Question number 1. What is the first step to identifying a student with a disability?
I think the first step is probably seeing his or her interactions in class.
What is the first step to identifying a student with a disability?
I would say like if they're learning differently or if they look behind in their classes, they might have a learning disability that way. I don't know.
What is the first step in identifying a student with a disability?
His behavior.
What is the second step to identifying a student with a disability?
Okay, I don't want to steal yours. I would say as you progress from looking at their behavior to look at probably the quality of work that they're putting out, whether that's in class, or also maybe how they're just learning inside and outside of the classroom, whether that's at home, possibly getting in contact with parents to see if they have any, if they are afraid of any learning disabilities or have seen any tendencies in their children.
What is the second step?
I would say maybe notifying the parent of the problem or setting up a classroom structure based around their disability.
What is the second step in identifying a student with a disability?
Testing him.
Question 3. What does RTI stand for and what is it?
I think RTI stands for responsible teacher interaction, and where it's the teacher's job if they think that there is a child with a learning disability or something that first of all they have to be interactive with them and just work more in depth with them to see if they actually have a possible learning disability.
What does RTI stand for and what is it?
I don't know.
What does RTI stand for?
RTI.
And what is it?
RTI.
What do you think it stands for? Pass.
Is this something related with disability?
What do you think? Yes.
RTI is, oh my goodness, I heard of it. I had to pass. I heard of it. Maybe I'll come back to it.
Or who identifies severe disabilities of young children?
Young children. What did I say before? Pediatric psychologist. I think that would be the person that identifies it in young children.
Okay. And how about school-age children?
School-age children. Well, once again, parents, also teachers. Whatever adults would be spending a lot of time with them during that time. So mostly teachers and adults or parents.
Who identifies severe disabilities of young children?
I would say maybe a teacher or a parent.
What about school age?
I'd say a parent or a teacher again.
Who identifies students with severe disabilities?
Psychologist.
Young children and school-age children.
Psychologist.
All right, question number 5. What group of students are most likely to be falsely identified as having a special need or disability?
I think that the most likely demographic that would be wrongly identified with a learning disability would probably be students who come from a different language background or maybe like ethnic. Just with diversity, maybe their first language is not English or whatever is being taught, and so in that way they just are starting off from a disadvantage and maybe wrongly identified as having a learning disability when really they're just starting off without some of the knowledge that other students have.
What group of students are most likely to be falsely identified?
Maybe minority groups.
What group of students is most likely to be falsely identified or referred?
Minority, Hispanic, and African American.